You're really committing to this mustache. Who's Tim? Oh, is this some Canadian superhero?
Oh, my heart. You poor uncultured man.
Let me have one time. Oh, yeah. I thought I
Kia ora everyone, good afternoon. Good news to begin with today. As of midnight last night, 2,293,301 doses of the Pfizer COVID-19 vaccine had been administered in New Zealand, an increase of more than 272,270 doses on this time last week. Within that, nearly 850,000 New Zealanders have now received 2 doses of the vaccine, meaning they are fully vaccinated. Just yesterday, we administered more than 46,600 doses nationally, our biggest daily total to date, and overall DHBs continue to track around 2% ahead of their plans. We began Group 3 in March. In the last 7 days, we delivered 120,418 Group 3 vaccinations, which is more than 3/4 more than we delivered in the same period a month ago. So we're seeing our vaccination rates increasing very quickly. That's encouraging, but it's also vital. As I said last week, we are seeing escalating COVID-19 numbers in countries all over the world. Far from coming to an end, this pandemic continues to escalate at this point. Increasingly, the main variant that we're dealing with around the world is the Delta variant. This variant is more transmissible, it's causing more hospitalisations, it is causing more people to die, and it's making younger people sick. We're seeing it wreak havoc, and that's why the government's been doing a lot of work to plan for the possibility that COVID-19 could once again make its way into the New Zealand community. Part of that work has been asking Sir David Skegg and the Strategic COVID-19 Public Health Advisory Group to look at how New Zealand might reconnect with the world while maintaining our elimination strategy and keeping New Zealanders safe. We welcome that report and its suggestions. I know many of you will have questions on that, and we will answer those tomorrow. New Zealand's got a robust contact tracing system, and we're seeing it in action, and it served us very well. As with every part of our COVID-19 response, we'll continue to focus on improving it. However, even the gold standard of contact tracing isn't always enough to keep the Delta variant at bay. We've seen that in New South Wales, where they've previously stamped out COVID-19 cases very efficiently with their contact tracing system alone, but they have not managed to achieve that this time. Sydney, Australia's largest city, is now in its 7th week of restrictions, including a stay-at-home order, which is the result of the Delta outbreak. For several days now, they have reported over 300 new cases. We in New Zealand do need to look at that and make sure we are taking the lessons that we need to take from that experience. So we're adjusting our response and our likely response to new, more infectious variants as we seek to ensure that COVID-19 does not gain a foothold here in New Zealand. So as we've done from the start, we would look to respond very quickly to any potential case of COVID-19 in the community. Yes, we would continue to use our contact tracing systems, but we would also look to escalate alert levels quickly in the event that we discovered a case of COVID-19. That means it is more likely that we would end up with a short, sharp move to COVID-19 alert level 4 for either the affected area or the whole country, depending on the circumstances, in the event that we saw a case of COVID-19 emerge. As we know from our own experience, the best economic response is also the best public health response is also the best economic response. We don't want to spend a drawn-out period of time with restrictions in place, and a short, sharp lockdown is more likely to be successful in the current context than a longer, more drawn-out, lower-level response. So my message to all New Zealanders is that this is not over, that we are still going to be dealing with COVID-19 for a while yet. Further lockdowns are possible. If they were to happen, they would happen as they did previously with very short notice. And everybody should have a plan for what they would do in those circumstances. We don't want to spend a long time in lockdowns. We don't want our health system to become overwhelmed, and we don't want COVID-19 spreading here in the New Zealand community. And so that's why we will continue to monitor vigilantly and to respond quickly should anything emerge. It's also why we continue to strengthen our border. And that's why we've decided, based on the latest public health advice, to add Indonesia and Fiji to the very high-risk country category. That means that from 11:59 p.m. New Zealand time this Sunday, the 15th of August, travel to New Zealand from Indonesia and Fiji will be restricted to New Zealand citizens, their partners and children, the parents of dependent children who are New Zealand citizens. Other travellers from very high-risk countries, including New Zealand residents, are required to spend 14 days outside of a very high-risk country before they can fly to New Zealand. The countries we announced in April, India, Brazil, Pakistan and Papua New Guinea, continue to remain in the very high-risk country category. We keep that under regular review. We put these stronger measures in place for specific countries as outbreaks there are out of control, and we want to reduce the risk to New Zealanders of people bringing COVID-19 here from those places. Travellers transiting through New Zealand from Fiji to other countries can continue to do so, but they'll be required to remain airside and spend less than 24 hours in transit in New Zealand. We've made that decision on the basis that at the moment, that if we didn't allow transit through New Zealand for people travelling from Fiji, there would basically be no way out of Fiji for anybody that's currently there. The government's continuously reviewing these border settings to ensure that COVID-19 is kept out of our country and out of our communities. Today, I can also report that expanded saliva testing, the program that we've signalled previously, is rolling out now across multiple sites. The first sites to be rolled out are at the Auckland Airport, the ports in Opua, Northport, Auckland, Prime Port in Timaru, Port Chalmers in Dunedin and Taranaki. Border workers who are on a 7-day testing cycle at these locations can begin saliva testing from today. This will be expanded over August and September to include the rest of the estimated 13,000 active border workers. It'll provide further surveillance testing at the border and an option for those who find the nasal pharyngeal swabs frequently to be quite uncomfortable. It's important that we continue to adjust and improve our border settings to deal with new variants of COVID-19 so that we don't lose the gains that we've made and the freedoms that we currently enjoy as a result of our elimination strategy. As Professor Skegg noted in his report, and I'm sure all of you have read that, we must prepare to maintain our border first before looking to open up our border. So I'll now hand over to the Director General and then we'll take questions.
Thank you, Minister. Kia ora koutou katoa. Today's headline figures: there are no community cases, and we have 2 new cases to report in recent returnees and managed isolation facilities. So our total number of confirmed cases to date is 2,548. Our other regularly reported numbers and details will be in today's statement from the Ministry. Just a little more on our COVID vaccination program. To further improve our vaccination reporting, we're now using what is called Health Service Utilisation, or HSU data. These data are now available on the Ministry's website, and there's been an Excel spreadsheet there since last Friday, and will be followed by more regular reporting from the next week. Importantly, these data allow us to drill more deeply into vaccine uptake by Māori and Pacific peoples, including the numbers of first and second doses and also the rates per thousand in the population, and we can also report by DHB on each of those groups. What I can say is, as of the 1st of August, vaccine uptake amongst Māori and Pacific peoples for those aged 55 and older were by and large similar to those for non-Māori, non-Pacific. For Māori, they were either the same or slightly higher, that is the rates of vaccination. We know that our Māori and Pacific populations have a younger age structure than the non-Māori, non-Pacific population. Around 77% of the eligible population of Māori and 79% of Pacific are under age 54. For those under age 55, currently our rates of vaccination for Pacific people are very similar to or higher than non-Māori, non-Pacific. For Māori, they are currently lower, but obviously as we move down through the age bands, we will have a particular focus on making sure the vaccination rates for Māori come up to those or exceed those of non-Māori. The work to date with those equal vaccination rates about age 55 for Māori and non-Māori reflects a lot of hard work that has gone in by our Māori and Pacific providers, and I want to thank them for that. Just on the Rio de la Plata, all the Port of Tauranga workers who were identified as having contact with that ship have now returned initial negative results. Additional tests were required on some port workers, 32 of them. All have come back negative, except there are just 6 that are pending, and we're expecting to get those follow-up test results today. As you will know, a total of 72 2 port workers were identified as contacts. 70 of those had a day 3 test, and the other 2, the 2 pilots, are having both day initial tests as well as a day 5 and day 12 test. They remain in isolation, those last 2, for the full 14-day period. So local Tauranga public health staff will be providing advice to border workers today on their return to work, and the majority are cleared to return to work today. The crew of the Rio de la Plata remain asymptomatic, and that vessel has now left New Zealand. Whole genome sequencing by ESR shows that was successful on 8 of the 11 samples, and showed that those 8 all had similar forms of the virus. They're all the Delta variant, and the results do link back to the pilot in Queensland who helped guide the vessel down through the Great Barrier Reef and was on the vessel for 2 days, and who subsequently returned a positive test in Queensland. So the assessment by ESR, and we would agree, is that the pilot was likely infected by the crew on the ship. Now, the Bay of Plenty District Health Board is working very closely, and has been for some time, with the port in Tauranga and the companies employing port workers to improve access to vaccination for those who are not yet vaccinated. They have staff on site providing vaccinations from Monday for the next 2 weeks to help support those efforts. As in a media release we put out earlier today, and as is standard practice with any of these incidents, I've asked that my team review the response over the last week to that ship, and I'll provide the Minister with an initial update next week with lessons and opportunities for improvement. And in addition, we'll do a fuller review looking at all the response to all 4 of the vessels that we've had over the last few weeks with infected crew members. That includes the Playa Zahara, the Viking Bay, and the Matina. It's important to note that, of course, there have been many vessels coming to New Zealand over the last more than a year, and because of the protocols, very strict protocols around use of PPE and minimising contact between crew and our workforce, that those measures have been very successful in keeping the virus out of New Zealand and preventing its entry through the maritime border. We are asking port workers, their close contacts, and the Tauranga community just to remain vigilant around COVID-19 symptoms and follow all health advice. And of course, I strongly encourage those of you who have not yet been vaccinated to be vaccinated. The international situation, of course, as the Minister's alluded to, continues to be of concern. There was an increase of 18% in the number of cases in the fortnight to the 7th of August. Total global cases now more than 200 million, and unfortunately total deaths now more than 4.2 million around the globe. The WHO continues to remind all countries that in order to defeat the pandemic, both within countries and indeed globally, we have to use a comprehensive approach of vaccines in combination with proven public health and social measures that we know work, and this is of course the approach we have taken in New Zealand since the start of the pandemic. And the global picture reinforces all the more the importance of booking a COVID vaccination when you become eligible. It's been great to see huge interest and response over the last few weeks as the capacity in the system has increased, and I want to thank New Zealanders for responding to that call, and I trust that those of you who haven't yet made a booking but are eligible will do so. It's going to be a very important part of our future ability to reconnect with the globe, as Sir David Skegg and others have pointed out. Back to you, Minister.
Jessica.
Will you phase in managed isolation for people who've had 2 vaccinations for 5 to 7 days? Do you see that as realistic? Is that something, a phased approach that you would look at taking?
One of the things we'll talk about tomorrow is what the future roadmap might look like. At the moment, today, of course, I'm focused on what we're doing at the moment. We're still some time away from that, but we will be talking more about that tomorrow.
Do you support the idea of a vaccine target? Do we need to have one?
No, I don't. I'm not willing to settle for anything other than everybody who's eligible to get a vaccine taking up the opportunity to get a vaccine. And that is what all of the epidemiological community are recommending as well, that setting a target anything lower than everybody getting the vaccine is setting yourself up to not be successful. And we don't want to do that. Everyone should be taking up the vaccine unless there's a very, very good reason why they can't. And that's a very, very small number of people.
You mentioned saliva testing as well. How many are being done now? What's the latest figures on those?
The numbers up till to now have been not good, so it is now much more widely available, and it's available now as an alternative to the nasal pharyngeal swab, so the cotton bud up the nose, to use the technical term. Previously, you had to do both. Now you can choose either or. So we do expect the uptake rate will be higher now, but that's really only starting to kick in from today.
Just on those.
To be clear, from now on, any sign of Delta, it's straight to alert level 4.
It depends on the circumstances, but I guess what I wanted to foreshadow today is that it's certainly more likely that our response is likely to be swift and severe in the event that we were to see a case emerge in the community.
The working hypothesis then for the Tauranga ship now that the crew infected the pilot on 23rd of July or maybe in the days beforehand, and then by the time they came here, they were no longer infectious. And is there any sort of viral load indication on their tests that show that they were all historical cases?
That is the working hypothesis, and what the positive test results showed is there was a mix of people who were in acute infection with a relatively low CT and others with a higher CT who were recovering from an infection. Interestingly, all were not symptomatic, and that remains the case as well. So some were probably bordering on being historical cases, but it looks like the virus was moving its way through the crew.
Minister, have you been given an explanation as to why the port was given flip-flopping advice on what to do with the ship?
I think as the Director General in the Ministry signalled earlier today, they're having a good look at all of that, and I'm expecting a report on that sometime next week.
Is New Zealand's health system prepared to deal with an outbreak of the Delta variant? Brian Beattie today said that our hospital system would be quickly overwhelmed if there was a large outbreak here.
I think what you find anywhere around the world where Delta has taken hold, or COVID-19 in fact has taken hold, their health systems are quickly overwhelmed. That's something we've avoided here in New Zealand, and we will do everything that we can to continue to avoid that in New Zealand. That's not to say that we haven't got our DHBs looking and planning for what they would do in the event that where they did see a sudden surge in COVID cases and they had to deal with that. Of course, we expect them to be doing that, but our primary focus is on making sure that that doesn't happen.
Do we have enough
Are you looking at increasing the number of ICU beds?
So things like ICU beds, ventilators, oxygen supply, all of those things, we were asking DHBs to consider all of those in their contingency planning. Perhaps I'll ask the Director General to add to that.
So two things there, thanks Minister. First of all, there is quite a well-developed ICU network across the country, and that has been in place for a while. And as part of the ongoing planning, of course, we look at whether and where new additional ICU beds need to be built. The challenge with ICU beds is not the beds so much as the staffing of them, because they require intensive staffing. One of the things we did last March and April was that we trained additional nursing staff to be able to, in the event of having a COVID outbreak, to be able to provide that level of intensive ICU nursing. And so all DHBs were required to train up additional nursing staff to be able to do that. As part of going back to district health boards to look at their readiness and preparation in the light of the Delta variant, they will have another look at that as well, just to make sure that is still current.
Do you have an indication of how many ICU beds that our workforce is now capable of being across? Like, I think at last count we had 744 ICU capable ventilators, which isn't a huge increase on what we had last year at the start of the pandemic.
Yes, I'd have to go back and relook at those data. I seem to recall we were reporting on those almost daily back in March and April last year, but we'll come back and just see what and provide data on the current state of readiness.
Basically asking if we ordered more ventilators, would we have the workforce to staff them?
I'll come back to you on that.
One of the main lessons from successful immunization campaigns overseas has been in many of them they've delayed their second doses to get more first doses. If you're now warning that Delta might be happening, and that was something that was also in the SCEG report, they said we might be liable to see a New South Wales type outbreak. Would it be more useful for New Zealand to have more people with first doses rather than the current system, which prioritizes second doses?
That is something that we've been considering, and you can expect to hear more from us on that shortly. I'm not announcing anything today, but it is something that we have been considering.
But what's the point of releasing the report today, but then not answering any questions New Zealanders have about it?
Look, that's the point of what we're doing tomorrow. Yeah.
So is that going to be covered tomorrow? Is that what you mean by shortly, or is this?
Yes, that would be a good guess. Yes.
Just back on Amelia's question. I mean, you didn't quite answer it. You've given the report. The information's out there in the public arena. Why not either have done that tonight or tomorrow, so we could all have had a read, or had the actual response today? Why this big wait?
I'm sure if we'd released it tonight for tomorrow, then people would complain they hadn't had enough time to digest it before the forum. So ultimately, the information is out there. People can digest that, and we'll be talking about it tomorrow.
Standard Seymour has been accusing you of focus grouping parts of the ski report.
That's just not true.
It's not true at all.
That's just not true.
And is that the full extent of the advice you've got?
That's certainly the full extent of the written advice, but we have also met regularly to talk through it, but the written advice is what we have released, yes.
In June, you were considering mandatory QR scanning for some venues. What's happened with that? Where's that gone?
It's working its way through the last stages of the final cabinet process. I think, as I foreshadowed, the issue that we had to work our way through was compliance and enforcement, because it raises some interesting issues around privacy and around how you do that consistent with the legal constraints that we have. I think we've now sorted that. So within the next week or two, you can expect us to make announcements on that.
There are a number of athletes who worked alongside Olivia Podmore and who are in MIQ. Would you consider giving any exemptions for those athletes who are still in MIQ to attend a funeral or memorial?
Well, first of all, can I just acknowledge the tragic situation and how difficult it will be for them to be in MIQ for that period, whilst they're also coming to terms with what has happened. They are not the only people that find themselves in these circumstances. Tragically, people end up in MIQ in really difficult personal circumstances, and the Olympians will be treated the same as everybody else who goes into MIQ, where a tragedy has happened. And so if they apply for some form of exemption, they would be treated exactly the same as others. What our MIQ team are very good at doing, though, is working with real compassion towards people who find themselves in MIQ isolated at a time when they really need to be with people. So they have, and I don't want to comment on any specific case, but they have, for example, made sure that they can have video links to funerals and memorial services. They've provided counselling where that, access to counselling where that is required. They do a lot to support people, to surround them with love, even though they can't actually be physically with other people.
Have they requested any exemptions or any...
Those exemptions don't come to me. They're processed by relevant officials based on health considerations. That is the number one factor that gets considered here. I would note that the Olympians are coming home from Japan, where the COVID-19 situation is concerning, and so it will be difficult for them.
I didn't mean you specifically,
Yeah.
I just meant in general.
I'm not aware if they've applied. Yeah.
So you're wording a
Yeah.
For the Trans-Tasman bubble, the report suggests that we should prepare for the bubble to be only available to vaccinated New Zealanders and Australians. Is that a realistic expectation for when it opens, if it even does reopen?
I think what we have signalled is that it's unlikely that the Trans-Tasman Safe Travel Zone would simply reopen in exactly the same form as it was before all of this happened. I think that things are likely to change. One of the things that we will, of course, factor in when we make the decisions about the future of Trans-Tasman travel is that vaccines, by that point, will be more widely available on both sides of the Tasman. And it may be that vaccination becomes a prerequisite for non-citizen travel. We'd run up against some legal challenge if we made that a requirement for citizens, for New Zealand citizens, but for visitors and others, it may become a requirement. But we haven't made a decision on that yet.
Are you investigating ways to circumvent that legal hurdle? Or?
Haven't at this point.
So that means it might not reopen. The next time it might reopen, Aussies will not be citizens have to be fully vaccinated to come.
That's certainly a possibility. I certainly wouldn't rule that out. In fact, I would say that that's something that we will actively be exploring over the next few weeks before we make that decision.
You've asked New Zealanders in their day-to-day lives to wear masks in public transit and to use a QR code, and their follow-through has been somewhere between bad and abysmal. Is the country complacent? Is it ready for Delta?
I think one of the, if I deal with masks and QR code scanning or contact tracing records, if I deal with those two things separately, I think you can expect to see mask use being a much more important and prominent feature of a response in the future. So if in any alert level escalation and so on, I think you'll see mask use much more included in that, and we'll set out the specifics of what that might look like soon. In terms of QR code scanning or record keeping, for those who aren't using the QR code system, yes, in the context of the Delta variant, that is very, very important. If we were to do a short, sharp level 4 lockdown, for example, the sooner we can contact trace everybody, the sooner we can isolate the risk, the sooner we can then get out of that. And that's why QR code scanning or keeping some other form of record, even a pen and paper, is so vitally important. If people do that, then in the event that there is an incursion of the virus somehow makes it through all of the layers of defence that we've built, then we'll be able to respond to that much more quickly if people have been doing the right thing. So am I concerned about our low rates of scanning at the moment? Yes, absolutely. Do I want people to do more of that? Yes, absolutely. Are we going to be using some additional tools available to us to ensure that that happens? Yes, we will, and we'll talk more about that in the next few weeks once Cabinet's ticked off those final decisions.
Could that include fines for people not wearing masks?
Like I said, once Cabinet has made the decisions, I'll work through the detail of that. It's not far off now. Joe.
Dr. Bloomfield, at the weekend, Mark Solomon described the Ministry of Health as the Ministry of Incompetence, and we've also heard the Health Minister, Andrew Little, say that he's extraordinarily frustrated by the way that the Ministry of Health and DHBs have rolled out some programs and that he himself struggles to get the information he requires to do his job. Do you have a response to that?
Oh, my response is that I'm very focused on doing the best job I can in this role, and I know my team are as well across all the work we are responsible for.
Have you had any conversations with Andrew Little about his particular issues, and are you working through them?
Oh, the Minister and I communicate regularly, and if there are specific issues that arise, we have a conversation and I respond to those as they do arise.
The fair criticism that he can't get the information he requires to do his job?
I'll just go back to the comment I made where we're focused on doing the very best possible job we can in our COVID response, the vaccination program, and across all the work we're responsible for.
Yeah, good.
Dr. Bloomfield, can you please give us your understanding of with Delta, what is the nature of asymptomatic transmission? Because I know there's been a bit of discussion about this in Australia, that you were contagious essentially further before you could tell than perhaps some of the early strains. Can you give us what's the latest sort of thinking on that?
Well, asymptomatic infection and transmission has been around with us ever since the virus appeared. The big difference with the Delta variant is that people seem to be infectious a couple of days sooner than they were previously. Previously, the sort of average incubation period was thought to be around 4 to 5 days. It now seems to be a couple of days shorter than that. Right from the start as well, there's been some evidence that asymptomatic people could in fact be, or pre-symptomatic people could be more infectious in some cases than those who did have symptoms. It very much is individual dependent. The trick here, and I mean, we've got this crew on board the ship who are all asymptomatic but are clearly infecting each other. The thing here is just that shorter period between the time people are infected and when they become infectious makes the contact tracing, testing, follow-up approach much more challenging, and this is what we've seen in New South Wales.
And is the New Zealand contact tracing machine, question for both of you, really geared up and ready to go to meet that shorter window?
Yes, we're geared up and ready to go, and also we've put some thought into how we might use that system differently. And again, we saw this with the recent case here in Wellington, where we went very widely and used the system intensively for just that one case. So early on, if we had a case or one or two cases, we would use the same approach. If we got further infections, we could not maintain, and we've seen New South Wales as well, you can't really maintain that level of intensity, so we would adapt it and use it a bit differently depending on the number of cases and also whether there was an alert level change in place at the same time.
Joe.
Minister, do you have an update on port workers' vaccination rates and what's happening there to get more done?
Yes, in fact, I do. So the latest numbers that we have in is that we now have 61% of our active port workers have had the full 2 doses. 9% have had 1 dose so far, so a combined total of 70%. Across the different ports, I can say that with the exception of Auckland, Nelson and Centreport here in Wellington, all of our ports are sitting at around 85% or higher for their port-employed workers. We do still have an ongoing challenge with our contracted workforces at the ports, so happy to run through those numbers. For ISO Limited, they have 200 people vaccinated and 230 unvaccinated. For C3 Limited, they have 206 vaccinated and 201 unvaccinated. For SSA New Zealand Limited, they have 157 vaccinated and 107 unvaccinated. For Independent Stevedoring Limited, they have 63 vaccinated and 87 unvaccinated. For Wallace Investments, they have 123 vaccinated and 60 unvaccinated. If you ask me again next week, I'm happy to provide an update on those numbers.
So when you look at what happened with the Port of Tauranga and how low that number was that just like a stroke of really bad luck that you had so few that actually had been vaccinated?
No, because the majority of people concerned here weren't necessarily employed directly by the port. They were employed by one of those companies that I've just mentioned.
So it's the contractors that are...
It is the contracted workforce at the ports that is proving to be challenging and the most difficult to budge.
And outside of the mandate that you've obviously put in place, which is still a little way off, what conversations or what can you do, I guess, with those private companies?
Well, those conversations are ongoing, and I'm happy to provide a regular update on how they are doing.
Okay, why did you suddenly change the rules yesterday to make vaccines more available to all port workers, even peripheral port workers?
Sorry, what was that?
Why did you suddenly change the rules yesterday so that everyone who comes into contact with the ports can get vaccinated rather than just strictly the frontline port workers?
I could speak to that. I had a meeting yesterday with the chief executives of all the ports that had actually been planned a couple of weeks previously, and this was raised with me as whether this is something that could happen, and I said I would take that back, talk to the team, and if we felt there was something that could be implemented, we would talk to the district health boards about ensuring that access could be widened to really anyone who touches the ports.
One of the things that to bear in mind is when we did Group 1 in the very beginning, when we defined who's in Group 1 at the very beginning, we were focused on those who were at risk working at our ports and at the border. And there are tens of thousands of people who work at the border. And if we'd included everybody who had any, interact with the ports, I should say, if we'd included anybody who interacted with the ports, we would have had a very, very large group, many of whom weren't in that high risk, most of whom weren't in that high risk category. Now that we are in the position where we can, where we've got bigger supply and we can do larger numbers of vaccinations more quickly, it is sensible to look at how to do that efficiently. And if we're having vaccination sites on site at the port, for example, as well as reaching those people who are required to be vaccinated, we can reach others as well, and that's a pragmatic and sensible thing to do.
Mr. With the warnings of lockdowns today, are you essentially saying that contact tracing is an effectual tool of own in dealing with the Delta variant?
What we know is that Delta moves fast, and so contact tracing needs to move fast as well. And one of the ways that we can assist the contact tracing to be effective is to limit the movement of people while that system kicks into gear and does that first part of the process. Previously, where the virus was taking longer to spread, the contact tracing process could get ahead of it. Now we know from our experience, from the experience across the Tasman, that if you don't get ahead of it very quickly, then actually it becomes very, very hard to get ahead of it without a prolonged period of restriction. So what I'm indicating is we're more likely to go hard and early again than we have been in the recent past, because we don't want to find ourselves having to do a longer lockdown.
So you get just a single case or a handful of cases, you lock down in that situation?
That is quite possible, yeah. I mean, you can never say absolute, yes or no, but certainly I think our tolerance for risk here is very, very low at this point.
Dr. Bloomfield, on a different health issue, there's some confusion in the debate around conversion therapy, so I thought I'd ask you as our top doctor. Is it your understanding that puberty blockers are a legitimate form of healthcare that's required to treat people with gender dysphoria?
Look, I'd have to come back to you on that. I'm very happy to follow up the question afterwards.
Okay. Other last questions, Katie?
Minister, what would you say to people who were maybe hoping that this report from David would provide, I guess, a clear roadmap to how the borders would be reopened, but I guess instead we've got a kind of cautious report that sets out how, I guess, it's very doom and gloom, and you've come up here today and said that level 4 lockdowns would be quite likely if we had Delta in the community. What would you say to those people?
I think if you read through all of the reports, you'll see that actually some of that advice, if anything, has become more pessimistic as time has gone on, and it reflects the fact that COVID-19 isn't a static situation. So we're constantly looking for room to improve and for ways to improve our systems, because the risk that we face is changing all of the time. Now, if COVID-19 had stayed the same over the last 18 months, I think that you could safely assume that we would have nailed down our responses It would be very predictable. People would know what to expect. They'd know the roadmap out. The reality is that's not what we're dealing with. We're dealing with a situation that continues to evolve and change. And so our response is going to need to evolve and change. Everybody wants to get out of the other end of this. No one wants to see the border closed for a prolonged period of time. I think we all want to be able to reunite with people who are important to us. We all want to have that sense of freedom to be able to travel again. Our business community, we all recognise that for our business community, the movement of people is vitally important. So none of us underestimate all of those things. As soon as we can provide more certainty, of course we will look to do that. Tomorrow what you'll see is the Prime Minister will set out some of our thinking, some of the markers along the road that people can expect to see, but it's not a definite blueprint with milestones and timelines, because there's still so much that we don't know. Derek.
If you were to be faced with a situation like at the end of June with the Sydney man who visited Wellington again and you knew that it was Delta, is what you said today an indication that even a scenario like that could see a harsher approach taken on level 3 or something like that?
Possibly, yeah.
And Dr. Bloomfield, would you think of yourself as a one-trick pony?
No.
How many tricks can you do out there?
I mean, look, I'll make a comment on that. If one trick is keeping New Zealand safe from a global pandemic that has wreaked havoc around the rest of the world, I think all New Zealanders can be very proud of the record of Dr. Bloomfield and his team. I think we have been incredibly well served by our health professionals in New Zealand during the global pandemic. It has been incredibly challenging. It has been uncertain. They've had to continue to evolve and adapt as the facts have continued to change. They've continued to provide reassurance to New Zealand when New Zealanders need reassurance. And I want to reiterate this again, our health system has continued to do everything that it would normally do despite the global pandemic, and we're one of the few countries that can make that claim. So I think Dr. Bloomfield has served us very well, and I think his whole team has as well. Derek.
There's just shy of 1,500 border workers who are found to be not complying with their legally required testing needs. That number has sort of been the same for several weeks. Is that just sort of what the reality is, that not everyone is just going to be, and that many people just won't get tested within the time frame that they need to? And what can be done about that?
Sorry, did you want to have a lash at that?
I'm happy to follow on from you, Minister.
Look, we're working really hard to make sure that that required testing order is being complied with, and it's a pretty granular process. So it's literally going through name by name to identify whether they've been tested, and if they haven't been tested, why not. Sometimes a legitimate reason is identified, they've been on leave or something like that. In other cases, it's that the timing is just a day or two out. In other cases, they may have skipped a test, and so that is something that we follow up on and that we would be concerned about.
Sort of 12% is roughly what's been static. So is that sort of an indication of that group of people, or is it?
It's only recently that the numbers have moved around, and it is only recently that we've been able to get back to having reliable reporting numbers, because for a while there, a significant chunk of the workforce weren't being reported because of the troubles that were happening in the Waikato. So we've been able to get back now to a point where we've got a baseline that we can have some trust in. That would suggest that that number is relatively static, but when you get into it and you bore that down, you get to, and in any particular case, so if we take MIQ for example, you get to a list of people. And when they work their way through that list of people, it's maybe a couple of dozen at tops, at the most. And when they go through that list of people, they can generally resolve it. But yeah, I would like to see everybody being tested in accordance with the requirements. Saliva testing, I think, will make a difference because it'll be easier and it'll be less invasive. But it is important for us that our border workers are all tested.
What's your assessment of rapid antigen testing at the moment, Dr.
Well, actually, I've got my team getting a plan together to test some of the better rapid antigen tests to see what place they might have in our response into the future. So that'll be one of the things that we'll talk a little bit more about tomorrow.
Lucky last.
Is it not disingenuous to say that there is, to get to the other side of this, where the report today paints a picture that there is no real other side of this, it is continued management of COVID-19?
Perhaps if I could use an analogy that Professor Skeeg has also used. the world didn't just return to normal after September the 11th. It returned to a new normal, and we got used to that. And life started to feel normal, but it looked a little bit different to the way that it was before. And I think that the similar thing will happen with COVID-19. There'll be a new normal, and we will get used to that. And we will have more freedom, and things will feel, more normal. But we don't yet quite know exactly what the road to that is. But we're going to set out some thinking on that tomorrow. Thanks very much, everybody.